For background and characteristic protists, protists are a diverse collection of organisms. While exceptions exist, they are primarily microscopic and unicellular or made up of a single cell. The cells of protists are highly organized with a nucleus and specialized cellular machinery called organelles. Protists is prokaryotes and mostly are unicellular. In addition, protists can reproduce asexually and sexually. Trypanosoma are flagellate protozoa. These types of protists are parasites, and the lastly is spread by insect. For the next slide is African Trypanosomiasis. African Trypanosomiasis, known as sleeping sickness. It's caused by microscopic parasites of the species Trypanosoma bursi. It is transmitted by the tsetse fly, which is Glossina species. It can be found only in rural Africa. It's currently about 10,000 new cases each year are reported to the World Health Organization. And lastly, sleeping sickness is curable with medications but is fatal if left untreated. So here is the cycle of African Trypanosomiasis.
How the disease transmitted. Sleeping sickness are transmitted by the bite of the tsetse fly. Tsetse flies live in rural areas where mostly in woodland and savanna. Tsetse flies only bite during daylight hour. Both male and female flies can transmit the infection. The infection can also be transmitted by blood transfusion or sexual contact, and a pregnant woman can pass the infection to her unborn baby.
Signs and symptoms of disease caused by protists are: first, a large sore, a chancre will develop at the site of the tsetse bite. Second, most patients develop fever, headache, muscle and joint aches, and enlargement of lymph node. Third, mental deterioration. Fourth, daytime sleepiness with nighttime sleep disturbance and progressive confusion. Fifth, personality changes. And lastly, experience partial paralysis or problems with balance.
How to prevent and control? First, wear long sleeve shirts and pants of medium weight material in neutral colors that blend with the background environment. Tsetse flies are attracted to bright or dark colors, and they can bite through lightweight clothing. Second, inspect vehicles before entering. The flies are attracted to the motion and dust from moving vehicles. Next, avoid bushes. The tsetse fly is less active during the hottest part of the day but will bite if being disturbed. And last but not least, use insect repellent. Permethrin impregnated clothing and insect repellent have not been proved to be particularly effective against tsetse flies, but they will prevent other insect bites that can cause illness.
The treatment process for African trypanosomiasis is by using specific drug, and the treatment course will depend on the type of the infection, whether Trypanosoma brucei gambiense or Trypanosoma brucei rhodiense, and the disease stage. Next is by using pentamidine, which is the most recommended drug for the first stage Trypanosoma brucei gambiense infection. But basically, there is no test of cure for African trypanosomiasis. After treatments, patients need to have their serial examination of their cerebrospinal fluid for 2 years.